established his work in type 1 diabetes and its complications at the University of Minnesota. His research is focused on the genetic basis of type 1 diabetes, having led the type 1 diabetes genetics consortium in following detection of risk loci with fine mapping using the diabetes immunochip, and functional evaluation of associated variants. In addition, he led the JDRF Diabetic Nephropathy, a collaborative research initiative, and served as a member of the National Advisory Council of the National Human Genome Research Institute at the NIH. He has been engaged as a volunteer with the ADA for nearly 40 years, starting with the Minnesota affiliate and serving on the Research Policy Committee, Associate Director of Diabetes and Diabetes Care, a member of the Pathways Mentorship Committee, and co-chair of the Precision Medicine and Diabetes Initiative. His work in atherosclerosis and cardiometabolic disease includes the National Heart, Lung, and Blood Institute supported multi-ethnic study of atherosclerosis and leadership in the exome sequencing project and the Transnomics for Precision Medicine program. He's also the recipient of the JDRF David Rumbach Award for scientific contribution for type 1 diabetes and its complications. So welcome. Before we start off, while we wait for questions, we just wanted to ask how to seek grant opportunities in terms of institutional funding, for example, to increase publication output. So maybe we can start with Dr. Cruz Bravo.
Okay, hello everyone. So thank you for the invitation. I did the Focus on Fellow program twice, and it was like a great opportunity for me. So I'm glad to be back now as a junior faculty. And I thought about talking a little bit about kind of how I navigated the academic career as a junior faculty that is also an IMG or an international medical graduate, and how I was able to kind of get some how to navigate funding in general at your institution. So when you look at kind of like 2021 applicants for endocrinology, there were about 396, and about half of those are IMGs as myself. And sometimes we think that we don't have room in academics. So I hope to convince you otherwise. So after, let me just backtrack a little. So after medical school, I briefly worked in clinical trials, kind of industry-sponsored clinical trials. And that was kind of what, to me, like started these, wanting to do clinical research as part of my career as a physician. But in residency, I really didn't have much time to focus on, and all my experience after clinical trials was a research fellowship that I did at the Mayo Clinic, where I did also some classes and got some experience and training there. But in fellowship, we do have to get a research mentor and a research project. So I did work with someone doing kind of insulin sensitivity studies and euglycemic clamps, which I think Dr. Rich does too. And I found that was not for me. That type of research was not for me. So when I was finishing fellowship, I was like looking for jobs, and I was fortunate to be offered a job as faculty to stay here. And I trained under a visa, a J1 visa, and it turns out like a lot of large academic medical centers are actually located in underserved areas, like inner city communities that serve a huge population of medically underserved patients. So it was eligible by the government rules to be a place where I could stay and do a waiver. With that said, there are restrictions as far as research. So early on, I was not eligible for federal funding opportunities, and I had to do kind of 100% clinical, but it actually gave me the opportunity to develop clinical research interests that I could pursue later on. So I work in a federal qualified health center, which if some of you are aware are these kind of community health centers that receive federal funding where patients can access different primary care services ranging from medical services, dental, optometry service, audiology services, behavioral health. So I was able to work there with patients doing diabetes care and was able to witness a lot of disparities, a lot of barriers that these patients were experiencing. And some were very simple, but it's just inability for PCPs to really get experience or up to date in a lot of the diabetes management. So from there, I kind of like got interested in diabetes disparities. And I'm gonna share kind of 6 resources, but I don't know how Kim wants to do it. If like you want to go with Dr. Rich, and then I'll keep talking later.
We can have Dr. Rich, maybe if you want to add a little bit here and then.
Sure. Well, one of the things that I think is critical about understanding how one navigates the research spectrum of potential sources of funding is that there are multiple ways of doing it. One is obviously you need a mentor who can help guide you. Oftentimes the university or academic medical center has, weekly emails saying, here are funding opportunities. However, it's oftentimes, very generic, and realistically, you'd like to be able to think, you don't want to necessarily try to get funding from an opportunity where you have very little chance. You want to optimize your opportunities. And if you were to try to write a grant to get money for what you want to do, every time there is an opportunity, you'll find yourself always writing grants and perhaps not being very successful. So in many ways, I think one of the first things to hope for in the location that you're at and where you're doing your work is, what is it internally that is available to help guide you into funding opportunities? Within our center, we actually have a 3-person senior faculty group led by myself and 2 other senior faculty who are available to advise and guide junior faculty and trainees in terms of opportunities, and not only guiding them into where the money might be located, but actually reviewing their components of their grants. So we would promise to review your specific aims page of your grant within a day, get feedback. And since these are senior faculty, they have a long interest in and experience in reviewing grants. And the whole process is, are there funding opportunities within the institution? Oftentimes, our medical school health system will have, pilot funding opportunities, and there will be, for example, grants that you may have submitted but not quite achieved funding, but have promise, at least in terms of the review. There's bridge funding. So they actually will give you money to continue your work in that area in hopes of building up your preliminary data sufficiently to be even more successful. And studies have shown that that's actually a very good plan. There are grant opportunities for foundations specific to the research you're doing. For example, the American Diabetes Association is going to be putting out 2 RFAs in the next week that will help guide research in specific areas. And if you're doing research in those areas, you should be applying for those. Obviously, there's the National Institutes of Health, and they have specific funding opportunities, but also generalized funding opportunities. So you put in a grant on your topic of interest, regardless of whether there's money set aside or not, but you're fighting with everyone else for that pool of money. If there is a specific notice of interest by NIH that fits what you're doing, you obviously should note that and go in that direction. So there's multiple sources. I think having a mentor very identified who is an active researcher in your area is always a good thing. So certainly look at different opportunities, different targets to your own research, as well as just generalized targets. So it's very useful to build a network of individuals who can help you. Don't do it alone.
All right. Thank you, Dr. Rich. Do you think you could talk a little bit more about the critical review criteria and a difference on emphasis?
Yeah, I mean, as with any review of a grant application, whether it's for $10,000 or $10 million, generally there are key items that every member of a review panel need to address. The classic review criteria for the National Institutes of Health and their study sections consist of what's the significance of the problem, what is the innovation that you're bringing to the problem that has not been applied previously, what's the research plan, how do you decide what you're doing, justify what you're doing at the time, and does one outcome lead to the next, or are these independent outcomes? What's the team around you, and what are the roles of that team, and do they have synergistic strengths? Are there any weaknesses? And then the overall research environment. Is the institution that you're at and the group that you're in, or those who are contributing from outside your institution, do they cover the necessary ground academically and scientifically to make it go forward? So those are the primary areas of review. And depending on the grant mechanism and the source of funding, there are different amounts of priority put on those levels. For example, a fellowship application, we used to think of it in three parts. It's the individual who's applying, how good are they? It's the mentor, how good is the mentor and the background of that mentor? And then what is the research being done? And so it's sort of three equal parts. But for a more established type of program, it may be different weights on those 5 criteria. And so it might be innovation and significance much more than anything else, or it might be the research plan much more than anything else. And so you have to know what type of mechanism you're really applying to before you can really understand perhaps the emphasis that's used in the review process. But I would say that innovation and significance is probably the 2 key points.
All right. Dr. Cruz, Bravo, do you have anything else to add?
So I think I would agree with what Dr. Rich said about finding the right mentor. I think I struggle a lot with that, as well as the importance of networking in your institution. Start with your institution to really get familiarized with the resources that your institution has, and a mentor to really be able to know what kind of funding mechanisms are good for you at your level. So what I did was I started paying attention to the emails and the newsletters, where sometimes people say X, Y, and Z published his work on this. And then I was like, oh, that's kind of what I would like to do. So then I would just email them and say, I'm interested in this area. Who could I talk to? Would you be willing to help? There is a group here of researchers that meet together and are interested in dissemination and implementation science. So I joined that group, and then they invited me to present my idea, gave me feedback, so things like that. And through that networking, I was able to actually find the mentors I currently work with. It took me a while because no one really guided me in the beginning. So I think start getting familiarized and ask, and not be afraid of ask. A lot of these centers that your institution might have, they're really eager for you to approach them And I didn't know that. So like approach the center managers, tell them like how can they help you, what kind of programs are available for, especially for early career. There are a lot of like, they call it like the small money that for early career faculty.
All right, great, thank you. And then moving on onto the application, what are your tips on making it more distinctive, readable, or clear? I guess we can start with you, Dr. Rich.
Yeah, I think it's interesting to think about selling yourself, but that's exactly what you have to do when you are asking for money, and there are 100 other people asking for money too. So you not only have to sell yourself in terms of the way you put the application together, but you also have to realize that you want to make it as easy as possible for the reviewers to read. That means that if you, and I would suggest that each of you think about how do you like to read. Let's just say that if you have 50 pages of material to read, and these grants are typically 10 pages, but if you have 50 pages to read and it's all text, I think that's probably pretty boring, and it's a difficult time going through 50 pages of text. If it's 10 pages of text, another, say, 20 pages of figures and 20 pages of tables that are very easily discerned, that's much easier to do. So I think the same thing happens in your grant application. The more figures that you have that visually tell the story, the easier it is to comprehend what it is that you're getting at. Even the research plan itself can be split up into a figure that has your specific aims. I want to do this first, and then I want to do that, and then the next thing in a diagram as a flow chart. I mean, that tells a story without 2 or 3 pages of text. So I would say one of the first things you do is to think visually and think how to tell a story in figures as opposed to text. The actual allocation for space for these different types of grants depends on the number of pages, the different pieces. Typically, there's maybe a half-page abstract of what it is you're doing. There's a 1-page of specific aims, of some background and what specific things you want to do. There's some specific text about the innovation, maybe half a page. There's maybe another half page sort of highlighting the expertise of the investigators. And the rest of it really are details about what it is you're planning on doing, how you're going to do it, if there are specific assays, if there are interventions, if there are clinical studies, what's the statistical analysis plan, the power, the impact of it, and also what happens after this is done. What's the future look like, and how your research is going to impact the field. So I think those are the types of things that should be in the grant and sort of the allocation of the specific components.
All right, great. And is there anything else you'd like to add to that, Dr. Cruz Bravo?
Well, so I guess writing a grant is hard. Definitely it's difficult. So you actually need to practice and not be afraid of being rejected. So I think starting by these pilot and feasibility opportunities at your institution is a good start. Those tend to be not like the time frame is shorter, but you still go through the same process in your head of all the components Dr. Rich was talking about. But it's also your institution that already likes you, or a little at least. So you're more likely to also be successful eventually. So I think it's important to not be afraid of writing the grant and submitting and showing to other people your ideas so they can really tell you like big picture, because sometimes I really struggle with the big picture. And the grants, it's very easy when you're a junior to be super ambitious, and then they're like, whoa, no, you can't do all of that. You really need to start focusing, narrow this down. So I think it's very important to not be like ashamed, share what you're thinking, talk to people. As I said, there were a few research groups that in my case have helped me here, giving me feedback, and I just say, oh, what does this look like? I also wanted to share a program that I joined, and I'm gonna share the link in the chat. Is sponsored by the National Heart, Blood, Lung Institute, and it's targeted to underrepresented minority junior faculty. It's a mentor program over a year that gives you funding for like a small project, and also has some like trainings over 2 summer institutes with faculty, and they gave you like a mentor from the program plus your home institution mentor, and they walk you through developing your project and accomplishing your project with the hopes that you'll get some preliminary data to carry on to kind of the next phase, or like a bigger grant. Either you want to go to like a K award, or you might have data for a pilot after that. So so here is the link, because the application is actually open now. So if anyone is eligible, I highly recommend this program.
Great, thank you for that. So since we only have a couple of minutes left, lastly, I just wanted to touch on the budget. So can you comment on how to refine and justify your budget in your application?
Well, I can tell you that, to be honest, these days, the reviewers don't really spend a huge amount of time on budget because they know that there's not enough money to do the work. But they do look to see what roles each individual will play on the research team, and also recognize that they expect that the person who is really the principal investigator of the award is going to be taking responsibility for the entire project. So they expect that that person will have a reasonable amount of effort on that grant. All the other aspects of that, including, travel costs, equipment costs, supply costs, if you're working in animal models, whether the charges, justifying the number of animals and what's going to be done. If it's human research, what are the aspects of recruitment, retention, the assays being done there. All those aspects, including computing costs. People don't realize that data storage is oftentimes a problem and costs things. So really make certain that it's laid out such a way that the reviewer can see exactly what's in the budget, what it costs, and why it's being done.
All right, perfect. And in just the last 2 or 3 minutes, this question is for each of you. What is the one biggest piece of advice you'd give it to graduating fellows applying for right now?
So I guess my piece of advice is something that Dr. Cruz Bravo had mentioned. Just don't be afraid to contact people and to ask for advice and even their help in sort of thinking through things. It's the way you move forward, is not only networking with people, but also, relying on their experience to help you move through the system and become successful.
Yeah. I think definitely getting a good mentor. And sometimes to me was like, I felt a little overwhelmed with the expectation of I needed to know what kind of research I wanted to do. So take your time, and it's okay to focus on being like a great clinician in the beginning, and eventually you'll start developing real interests that will, be something that you're really passionate about, and then that you would really want to pursue and feel fulfilled, I think.
All right, I don't think we have any questions. I guess if anybody does have any questions, please feel free to type it into the chat box. But I just wanted to thank both of our presenters today for such a valuable, informative session.